So hello everyone, good day. So for today, our lesson for the PE12 is Unit 9, Lesson 4, Safety Precautions in Mountaineering. Learn about it. In case of emergency, some people tend to panic. Keep in mind, though, that it would not be good to react in this way because it does not help in the situation and may cause others to worry and panic as well. Rather, in an emergency, do your best to stay calm. Okay, so na yung mga emergency, so you should be calm now, guys. And rather, in an emergency, do your best to stay calm. This way, you can clear your mind and use rational thinking to come up with solutions to the problem. So, imbis na mapanik ka, stay calm na ka para makakunaw na ka. Then remember and apply the DRS-ABC action plan. So, na yung mga DRS-ABC action plan na pwede ito gamitin during emergencies. First is letter D, danger. Make it a point to check for danger in the surroundings first and to determine the source of injury. So first daw, kailangan na ito i-identify kung asagitan ang danger or naabay danger sa surroundings. Ensure there are no hazards in the surroundings so that you yourself will not be injured as well. So make sure daw na safe ka and para dili ka maapid og danger. Next, the R is responsiveness. If ever nga naa kay mga kauban or mga nakitaan na na-injured, make sure na responsive sila. Kung manawagan ba? Or maka-open ba sila silang eyes? Makalihok ba sila? Maka-feel ba sila sa kunitan? Send ang ikatulo. The letter S is send. Send for help. You may shout as loudly as you can to attract the attention of others. So if ever nga rescue ka, nakinakitaan na responsive po siya, and then dira ni mo mangita ka help sa others. Airway. It is important to make sure that the person's airway is clear, and in case he or she is conscious and unresponsive, open the mouth. So make sure na to ang iyang airway is clear para maginawa siya taro. In case to nga unconscious siya o unresponsive, make sure na to may open na to iyang mouth and take a look to check the airway. So i-check na tong area if natabunan ba or maginawa ba ng taong or natana. First, itong buhaton is tilt the head back, then have the chin face up. So kailangan na naka-tilt atong head pa likod, and then isa ka na tong chin para mo-clear yung airway. And B is breathing. Check for signs of breathing. Feel if air is coming out of the mouth or not. So check mo kung ginawa ko pud ang imong i-rescue. Ano lang. And then the C is CPR or cardiopulmonary resuscitation. If the person is not breathing, pag siya ginawa, walay puso and unconscious siya, dira ni mo buhaton ang CPR until maabot ang mga medics or mga other personal healthcare or personal arrive mga healthcare. So, cardiopulmonary resuscitation or CPR is an emergency procedure that is meant to restore a person's normal breathing during a medical emergency such as cardiac arrest or drowning. So, kaning CPR guys, ginamot ni siya in a procedure during emergency para mabalik na to into the normal state. Dili gud siya fully recover pero at least nun lang ma-conscious ang sa katawan and mabalik iyang breathing. This procedure involves the CAB process, decompression, airway, and breathing. So when doing first aid, it is a must to know when CPR is needed. So dili po nang pataka-arakag CPR tapos dili siya kinahanglan. So kasi maka-cause na further injuries. And check the person's breathing and pulse. If he or she is not breathing and has no pulse, do a CPR cycle of 30 compressions and 2 breaths until medical help arrives. So if dili siya ginhawa, wala siya pulso, so dira nimo ma-apply ang CPR. Kinahanglan nimo 30 compressions tapos duha ka ginhawaan or 2 breaths until maabot ang mga medical mga personnel. Keep in mind that the following should be done. So na yung mga kinahanglan i-follow. So nakita niyo the area. Make sure that the individual is lying down in his or her back on the flat surface. So make sure na to nga nakahiga siya sa flat surface. To locate the proper position for doing hand compression. Siyempre dapat kabulong akong asa dapit ka mag-kimuog hand compressions. Draw on imaginary line from the person's armpit to the center of the chest. So i-follow na mo siya. On the breastbones, lower part, put the heel of one of your hands. Okay, kani siya. Place your other hand on the top, then provide support by interlocking your fingers. So keep your arms straight and shoulder position over the individual's chest, then push down on his or her chest. If the individual is an adult, the pushes should be 5 centimeters or 2 inches. So i-make sure nimo nga straight yung arms kapag naka-position. If ever dili straight ang arms, wala siya puso mo, wala siya, In a span of 18 seconds, give 30 compressions or fewer. Make sure to allow the chest to completely rise in between the compressions. So, dapat sa 18 seconds, maghatag ka og 30 compressions or pila. And then, i-make sure na to nga ang chest niya is mo rise pa siya bago ka mo compress sa kupal. Once you are done giving 30, maghatag ka duha ka breaths. Ano lang. And then do the cycle over and over until maabot ang medical personnel nga maka-help sa imo. Or mag-stop na lang ka if na siya consciousness or mag-move na siya. We have the common injuries in outdoor recreation and their first aids. So first aid pertains to the care given to aid in the individual's recovery before regular medical services can be administered. Typically, first aid involves simple but life-saving methods that lay people can perform with no to minimal equipment. First aid is not considered medical treatment and must not be compared to what a doctor or medic can do. So kaning mga first aid daw is muna siya ang must nimo i-bring every time na mulakaw ka. Because kay for example, yung mga emergencies na kailangan gamiton dili ko dahil na mo doctor, so maybe mga medic dayon. So syempre, for example, nakasakala sa man and then wala yung mga doctors and medic na kauban, syempre kailangan land ready. So we have cuts, scrapes, and punctures. So there are various incidents in the outdoors such as stumbling, tripping, and cutting oneself accidentally with a knife that may cause one to have scrapes, cuts, and wounds. So common injuries in outdoor recreation and their first aid. First aid pertains to the care given to aid in the individual's recovery before regular medical services can be administered. So ang mga first aid, muna siya ang pinakauna na mahatag na care sa isang person if ever injured sila before pa sa regular medical services. Typically, first aid involves simple but life-saving methods. So, although simple siya, pero nakuha siya ang tama. Pag naamoy mga emergencies na ma-face, that lay people can perform with no to minimal equipment. First aid is not considered medical treatment and must not be compared to what doctors or medic can do. So, ano first aid, dili mo siya compare sa medical treatment. Kung dili po na siya compare sa mga mahimo sa doktor and sa mga medic, ito limited lamang good ang provide sa first aid. So, first we have cuts, scrapes, and punctures. There are various incidents in the outdoors such as stumbling, tripping, and cutting oneself accidentally with a sharp object or a knife that may cause one to have scrapes, cuts, and wounds. To administer first aid for this, do the following. So, para ma-administer na ito ng mga cuts, mga saban na ito dira, you should do the following. First, wash the area immediately with soap and water. Apply antibacterial ointment to the area. Then, cover it with a clean and fresh gauze and medical bandage. If ever na nakaisaman, scrape, and medyo na you need to wash your wounds na yun with soap and water. Siyempre, ang water dapat limpyo po ang water. And then, magbutang tag antibacterial ointment around anong dili alcohol because dili man good ma-recommend sa mga medic if ever na nakay-open wound, dili siya nindot lang ito ng alcohol. Then, cover it with a clean and fresh gauze. In case of bleeding, put direct pressure on the wound using a clean cloth. So, pag na-ay bleeding, syempre mabutang tag pressure para malesen ang iyahang pag-bleed. If it is the arm or the leg that is wounded, raise the injured limb above the heart. Doing so would aid in slowing down the bleeding. So, if ever nga dari sama o sa tiil, make sure na isa ka lang mas taas pa sa heart, kaya mas maglisod magun ang heart o pump or mas inay siya because hindi lang siya. And do not place a tourniquet on the limbs unless there is severe bleeding and the bleeding does not stop even after the pressure is applied. So, dili na tanid magbutang og tourniquet unless na lang kung dili undang ang isa kasama nga mag-bleed. And then, call emergency services right away in case the following happens. First, apply direct pressure and the wound does not stop or severe bleeding happens. So, manawag na pag-emergency, pag i-apply ni mo ang direct pressure, dili mo undang ang isa ka bleeding and then musamot siya and then second, the wound area is inflamed and the patient is in severe pain. So you think they may be internal bleeding. So if ang wounded area is inflamed siya or something, basta na-inflame siya and then ang patient na siya in severe pain, dili na niya maliho or na. So feeling ni mo na siya internal bleeding mo, tawag ka emergency services. The wound is on the patient's chest or abdomen. If ever nga naa siya sa chest and abdomen nga part, mo syempre mo tawag jud ka ang emergency services kay basig mag internal bleeding or maapektuhan ang mga internal organs. And then last kay blood spurts from the wound. If kanang na imong blood kuma siya imong wound kanang gusto siya bleeding. That's it.
Next, we have the common injuries in outdoor recreation and their first aids. First aid pertains to the care given to aid in the individual's recovery before regular medical services can be administered. Typically, first aid involves simple but life-saving methods that lay people can perform with no to minimal equipment. First aid is not considered medical treatment and must not be compared to what a doctor or a medic can do. So, we all know what a first aid is. We have been taught what a first aid is back in the past or during our junior high school days. And of course, first aid is just there in case of emergencies, especially when it comes to sports. So first, we have the cuts, scrapes, and punctures. There are various incidences in the outdoors, such as stumbling, tripping, and cutting oneself accidentally with a knife that may cause one to have scrapes, cuts, and wounds. To administer first aid for these, do the following. Wash the area immediately with soap and water. Apply antibacterial ointment to the area after that. Then cover it with a clean and fresh gauze and medical bandage. In case of bleeding, put direct pressure on the wound using a clean cloth. If it is in the arm or the leg that is wounded, raise the injured limb above the heart. Doing so would aid in slowing down the bleeding. Do not place a tourniquet on the limb unless there is a severe bleeding and the bleeding does not stop even after direct pressure is applied. So if you got a cuts, scrapes, and punctures, do this type of first aid. Call emergency services right away in case the following happens. If applying direct pressure on the wound does not stop bleeding or severe bleeding happens, if the wounded area is inflamed and the patient is in severe pain, so you think there may be an internal bleeding, if the wound is on the patient's chest or abdomen, or if blood spurts from the wound. Next, we have the sprains, strains, and fractures. As mentioned previously, doing outdoor activities poses various risks and may cause injuries. One may trip while hiking or miscalculate a movement while doing rock climbing. Typically, the body parts that end up being sprained or the finger, wrist, and ankle, while the hamstring is the one that is often strained. Injuries such as fractures, strains, sprains may produce bruising or swelling. So these are the differences between the sprain, strain, and fracture. A sprain is a type of injury that occurs when the ligament is stretched or torn. This typically happens when one overextends a joint beyond its normal motion range. A strain, on the other hand, occurs when a tendon or muscle is twisted or pulled. Activities such as running or jumping may cause this, as these are activities wherein muscles are stretched and can suddenly contract. A fracture is a type of injury that occurs when a bone breaks. Again, a sprain is when the ligament is stretched or torn. Strain occurs when a tendon or muscle is twisted or pulled. A fracture is when a bone breaks. So of course, doctors divide sprains into groups based on their severity. The grade 1 group consists only of mild injuries including the tearing of ligaments or muscles. The grade 2 category comprises cases in which tendons or ligaments are partially torn. Grade 3 cases are those in which a tissue or tendon has completely broken down. The 4 components of RICE, meaning rest, ice pack, compression, and elevation, can be employed to treat grade 1 and grade 2. This includes resting the injured or sore area, then using an ice pack or compressing the bruised area with a bandage or sports tape, and reducing swelling to a minimum. Grade 3 injuries may require additional immobilization in order to heal faster. In the illustration below, athletic tape or a bandage can be used to compress the injured area. Using athletic tape, create a basket weaving pattern as you can see on figure 10.1 below. Apply the anchor strip to the back of the calf, then put another anchor strip under the instep of the foot. Create a stirrup strip by applying the strip down the calf above the ankle beneath the foot and back again to the anchor strip on top. Make a horseshoe strip placed below the ankle, around the heel, and across to the anchor strip on the bottom. Before the leg is completely supported, keep adding stirrup and horseshoe strips in an alternating pattern like a basket. And of course, make sure to use the figure 8 pattern when using the bandage, as you can see on 10.2. Across the top of the foot, wrap the bandage diagonally. Have it go over the ankle and the foot, creating the pattern of a number 8 as it is placed around the heel and the calf. Make sure that the bandage wraps around the whole foot and ends a couple of inches above the ankle. Keep the bandage in place using a clip or tape. If the individual has a fracture, seek immediate medical attention in case of the following. If it is suspected that there is injury to the individual's back, neck, or head. If bone is protruding through the skin. If applying firm pressure to the wound does not stop the bleeding. And if there is blood spurting out from the wound. While you wait for medical help, perform the following first aid measures. Make sure The injured body is immovable until the patient can be seen by a doctor or is brought to a hospital. Before applying a splint, make sure that the wound is cleaned and dressed. In case of a bleeding wound, apply firm pressure to stop the bleeding. If bone is protruding through the wound, however, do not touch it. Get a ruler, rolled up newspaper, or rolled up piece of clothing. Tape it gently to the fracture. Take care not to move the fractured body part and do not attempt to twist it back into its original position.
C is for the concussion. A concussion is a brain injury that is usually brought on by a blow to the head or the body. A concussion may bring with it loss of consciousness and may cause the patient to forget what transpired before the injury. Do the following if the individual has a concussion. Treat any wounds or bruises. Apply ice or a cold compress. Have the individual rest until there are no more symptoms and look out for symptoms that require immediate medical attention. Call for the medical help if the following situations happen. The patient vomits over and again. The pupils are unequal. The patient looks confused and disturbed. The patient faints or is unconscious. The patient feels very drowsy. The neck is painful after the fall. The patient's speech is slurred. And the patient has a seizure. D is for the blister. Wearing footwear that does not fit well results in blisters. Blisters are particularly common among hikers and trekkers. Blisters are uncomfortable and painful. They can be treated by doing the following. Cover the affected area with a bandage. If the blisters are at the soles of the feet, place donut-shaped moist skin over them. If the blisters have popped, clean them with water and soap, then apply antibiotic cream. In case the blisters have not popped and it is necessary, you may drain it using a sterilized needle. Apply antibacterial cream, then cover the bandage and secure with tape. E is for the scalds or burns. Burns or scalds are injuries to the skin caused by coming in contact with fire or hot liquid. If one catches fire, use the stop, drop, and roll technique to stop the spreading and extinguish the fire. Remove the flaming material from the individual. If, however, the clothing has stuck to the skin, do not pull it. Rather, just tear or cut around it. Remove accessories as well as constructive clothing like jewelry, belts, tight clothes, because burns can swell fast. Do the following for first-degree burns. Only the topmost layer of skin is affected. Keep the affected region under running water or submerge into cool water until the pain dies down. If there is no available running water, apply a cold compress. Next is wrap the affected area with a sterile bandage that is non-adhesive or a clean cloth. Last will be do not apply ointments as doing so can cause infections. While do the following if you experience second-degree burns or the top two layers of skin are affected. For 10 to 15 minutes, submerge the affected area in cool water. If there is no available running water, use a cold compress. Do not place ice on the affected area as doing so can cause one's body temperature to lower and can cause more harm. Do not apply ointment to the burn as it can cause infections. Wrap the burn with sterile, non-adhesive bandage. To prevent shock, have the individual lie down on a flat surface. Elevate the feet around 12 inches, then lift the burn area at around heart level if possible. Then cover the individual with a blanket. And last, wait for the arrival of medical personnel. For burns, seek immediate medical help in case of the following. The burn affects all layers of the skin. The skin looks scored and has patches of brown, black, or white. There is oozing in the burn blisters, or the blister is bigger than 2 inches. The burned areas are in the face, hands, feet, or genitals. And last, the affected person is a senior citizen or an infant.
Ailments or illnesses. First is fever. It's critical to monitor your body temperature. Low-grade fever is defined as a temperature of 38 degrees Celsius or 100.4 degrees Fahrenheit or below, and it requires no treatment other than getting the patient to drink plenty of water and have much rest. In case the patient is uncomfortable, over-the-counter medicines such as ibuprofen, acetaminophen, or paracetamol may be given. It is a must, though check whether the patient is allergic to any kind of medicine. Also keep in mind that aspirin must not be given to any minor. If the fever is 38.8 degrees Celsius or 102 degrees Fahrenheit or higher, give the patient oral medicines to help lower the body temperature, administer a sponge bath, and have the patient drink more water. Make sure that the clothes worn are light, as heavy clothes can increase body temperature. If chills are experienced, cover the patient with blankets until the chills are gone. Emergency assistance should be sought in the following situations. First, the patient is unresponsive. Second, the patient is having difficulty breathing or is wheezing. Third, the colors of the lips change. Fourth, the patient suffers from tremors or epilepsy. or the patient appears perplexed suddenly appear. Second, headache. Second is headache. There are various factors that causes headache during hiking or trekking. These factors include dehydration, tension in the neck, lack of protection for the eye against the sun, and brain tissue swelling because of excessive sweating over a couple of days. When experiencing headaches, you may take over-the-counter medicines such as aspirin, ibuprofen, or paracetamol. It is important whether to observe and determine the cause of the headache since it may also be a symptom of the different ailment. Third is altitude or mountain sickness. Altitude sickness, are also called mountain sickness, occurs when one's rate of ascent is faster than the body's ability to adjust to higher altitudes. Since there is a lower level of oxygen in higher altitudes, the body needs to increase ventilation to compensate and adjust. Not being able to do this results in altitude sickness. Factors that affect or worsen altitude sickness include climbing too fast, overexertion, hypothermia, drinking alcohol, and insufficient water intake. Altitude sickness may be mild, but it may also be life-threatening. Life-threatening cases of altitude sickness are high-altitude pulmonary edema, or HAPE, and high-altitude cerebral edema, or HACE. Those who experience HAPE have difficult breathing because fluids have accumulated in the lungs. If not treated, this can cause respiratory collapse and may even be fatal. Those who experience HACE, on the other hand, have accumulated fluid in the brain. This can alter the individual's mental state, leading to loss of coordination, coma, and death. If an individual has HAPE and exhibits the following symptoms, they should seek immediate medical attention like chest tightness or shortness of breath while standing motionless, breaths that are sputtering or rumbling, coughing up frothy or pink sputum, lips or fingernails that are bluish or grayish, obstructive pulmonary disease, and exhaustion. The onset of HAPE might be slow or abrupt. After staying for a long time at a high altitude, HAPE frequently develops. Uncertainty is a classic sign of cerebral edema at a high altitudes. When a person gets HACE, it becomes difficult for him or her to compete with the others of the group. Walking and coordination abilities are hindered. As the brain swells, lethargy and then comatose will occur. If the symptoms are severe, descend as rapidly as possible to 1,500 to 2,000 feet while exerting as little effort as feasible. If the symptoms are modest, the person should not go any higher until they have completely disappeared. Relieve the signs when possible, offer oxygen, warm the individual, relax him or her, and provides lots of drinks or beverages and painkillers.
Hyperthermia. Hyperthermia is a condition that occurs when a body creates or attains beyond what can disperse. Individuals with hyperthermia experience heat cramps, heat exhaustion, and heat stroke. Heat cramps. The most prevalent cause of heat cramps is doing excessive physical activities in hot temperatures. Heat cramps manifest as painful and involuntary muscle spasms in the arms, calves, abdominal wall, and back. These heat cramps occurs when the muscles collect too much lactic acid and suffer a loss of too much electrolytes and fluid because of precipitation. The following are the steps that should be done when one has heat cramps. Consume a sport drink or hydration tablets to replace lost electrolytes. Gently extend and knead unaffected muscles. Take a break from doing any religious physical activities and rest until the cramps are gone. Consume a salt pill with water when muscle pain is felt. Another one is heat exhaustion. One's body experiences dehydration and salt depletion when the intake of water is not enough to meet the body's demands. This usually happens when one does rigorous physical activities. Symptoms of heat exhaustion include dizziness, having a rapid and weak pulse, nausea, cold, and sweaty skin. When experiencing heat exhaustion, administer first aid similar to the first aid given to heat cramps. Last one is heat stroke. Heat stroke is the most serious and severe case of hyperthermia. The following situations require emergency assistance. The person gets disoriented, the person suddenly experiences seizure, the person has red, warm, dry skin, and his or her body temperature rises above 103 degrees Fahrenheit or 39.4 degrees Celsius. The person's pulse rate suddenly becomes fast, and the person's experience reduced sweating. Administer first aid while waiting for help. Remove the victim from thermal stress and chill them using whatever measures are accessible, such as damp blankets, ice water spraying, and apply a cold damp towel or gauze in the underarm, neck, and crotch. Use a fan to increase ventilation. Do not give the person anything to drink if he or she is not awake or is vomiting. Attend to the signs and symptoms. Keep the person away from danger if he or she is having seizures. Turn the person to the side if he or she is puking to prevent airways from being obstructed. Hypothermia. Cold, windy, and damp weathers can cause one to have hypothermia. Hypothermia develops when the body's ability to create heat cannot keep up with the chill brought by the weather. This happens when the temperature drops below 35 degrees Celsius. Some of the symptoms include numbness, excessive shivering, muscle stiffening and becoming uncoordinated, skin turning bluish, slowing of the pulse and breathing, and loss of consciousness. As quickly as feasible, first aid must be administered. Place the patient in a safe place and slowly warm his or her body. Remove wet clothing and replace it with dry clothing. To keep warm, wrap the patient in covers or a sleeping bag. Warm air should be exhaled near the mouth and nose of the patient. Keep in mind that quick warming can trigger heart arrhythmia, so do not submerge the patient in warm water. Warm the person's trunk first and not the arms or legs to avoid shock. Look for ways to keep the patients awake. If CPR is required, start it right away and keep it until medical personnel arrives. Thank you for listening.